Hi everyone, I'm Dr. Divya Shanthi and welcome to NEET PG Core Revision series. These series are focused, structured and exam oriented so that you are able to recall faster and more confidently in your exams. In today's session, we'll break down the Circle of Willis and the blood supply of brain into clear, high-yielding, exam-focused concepts. So let's get started. The brain needs continuous supply of blood because of its high metabolic demand for oxygen and glucose. It is highly sensitive to both hypoxia as well as hypoglycemia. Consciousness is lost within 10 seconds of cessation of blood supply to the brain. And if it is not restored, the irreversible brain damage starts within 4 minutes and is completed by 10 minutes. So that is why the blood supply of brain is of utmost importance. The brain is supplied by two systems mainly, the internal carotid, that is the carotid system, and the vertebral system. So the carotid system consists of a pair of internal carotid arteries, and we have the vertebral system which consists of a pair of vertebral arteries which join to form the basilar artery. So these major arteries which supply basically the cerebrum. Okay, so the vertebral arteries here we can see. So these are the vertebral arteries. And this is the internal carotid artery. So these major arteries supplying the cerebrum, that is the branches of the basilar as well as the branches of the internal carotid artery, they get interconnected. Okay, so you can see they get interconnected at the base of the brain. So this is the base of the brain here, and they form a six-sided, that is a hexagon of arteries, a six-sided polygon, which is called as the arterios circulosus, okay, or circulus arteriosus, or Circle of Willis. So this is the Circle of Willis here. So this Circle of Willis, we see it around the interpeduncular fossa. Okay, so we see it in around the interpeduncular fossa. So around here we see, and it lies in the interpeduncular subarachnoid system. Okay, interpeduncular subarachnoid system. So here we see. So it contributes to the major arterial supply to the brain. Now we will see how this Circle of Willis is formed. So let's have a closer look. So here these two vertebral arteries, they join to form the basilar artery. Now this is the basilar artery. Now this is the Circle of Willis, and here we have a pair of internal carotid arteries. Now the Circle of Willis anteriorly here, this is anterior. So anteriorly it is formed by the anterior communicating artery. This is the anterior communicating artery which communicates to here on either side. Okay, so anterolaterally here we will have the anterior cerebral artery. Anterior cerebral artery. So these two will be the anterior cerebral arteries, and in the center we will have the anterior communicating artery. Then posteriorly here we have the basilar artery will divide into two. Here this is the posterior cerebral artery, this is the posterior cerebral artery, and here we have the posterior communicating artery. So posterolaterally we will have the posterior communicating artery. So these arteries, okay, so will form the Circle of Willis. So this normally we have to understand that there is very little mixing of blood of the two vertebral arteries within the basilar artery, and there is no mixing of blood of internal carotid with the posterior cerebral artery through the posterior communicating, okay, and as well as through the anterior communicating. So basically it means that the right side, the vessels will be supplying the right half of the cerebrum, and the left side, the left half of the cerebrum. So only when there is an occlusion, then these communicating arteries will communicate so as to compensate for the loss of blood. Okay, so wherever there is necessary, it will supply through these communications. So collateral circulation will be established in that way. Now congenital cerebral aneurysms are very common, which we will be dealing a little later in this region. So let's now look at the arterial supply of superolateral surface. Now superolateral surface here, okay, so it is mainly supplied by the middle cerebral artery. So here you can see this whole red area in the center is supplied by the middle cerebral artery. And here in the upper part, a narrow rim here is supplied by this will be along the superomedial border. There we have the anterior cerebral artery. And here near the occipital pole and along the temporal, okay, the little bit along the lower border, we will have the posterior cerebral artery. So what happens if these arteries are occluded now? Okay, so occlusion of the anterior cerebral artery. Okay, so this is the anterior cerebral artery distal to the anterior communicating. So when we see here, this is the anterior cerebral artery, and distal to the anterior communicating, if there is an occlusion, then it will produce, depending upon, see you can see what area it is supplying. So depending on that, it will produce contralateral hemiparesis. Okay, so when we say hemiparesis, it is just weakness but not complete paralysis. Okay, so it will produce, so the anterior cerebral artery here will produce anterior cerebral artery occlusion. We will see what? We will see the contralateral hemiparesis, contralateral hemiparesis, as well as hemianesthesia. But here you can see which area this artery will supply. Okay, because it is involving here, and our body is represent upside down, right, in this area. So it mainly affects the leg and foot. Okay, so involving mainly the leg and foot here, because the upper parts of the motor and sensory areas and the paracentral lobule is involved here. Okay, so that is why we will see these things. And there is also inhability. So here you can see, now this is the central sulcus, this is the superior parietal lobule here, right? Superior parietal lobule here. So because of the involvement of that, there is inability to identify the objects, that is astereognosis. Then because of this frontal lobe being involved here, this portion, okay, we will have 𝗵𝗵𝗔𝗟 as well as personality changes. Personality changes we will see. Okay, so that is in anterior cerebral artery occlusion. So if you know what area it supplies and what area it represents, it is easier to tell the symptoms. Then coming to the occlusion of middle cerebral artery. So middle cerebral artery here will produce, now we can say there is what it will, since it is involving major area, it will produce hemiplegia. Okay, so there is hemiplegia in middle cerebral artery occlusion. There will be hemiplegia hemiplegia as well as hemianesthesia. Which part is involved here now? Because it is represented upside down. Yes, the face. Okay. So the face and the arm. The face and the arm area is involved because mainly the main motor as well as the sensory area is involved here. Then here we have what area do we have here in this region? We have the Broca's area. Correct? So there is aphasia, Broca's area, and here we have the Wernicke's. So we will have what? We will have aphasia. Aphasia of the, if it is involving the left dominant hemisphere, then we will have aphasia. Okay, because of the involvement of both motor as well as sensory areas, speech areas. Then a small portion here. Okay, so near the occipital lobe, because of the involvement there may be contralateral homonymous hemianopia. Okay, because of the involvement of the optic radiations. So these are the things which we see in middle cerebral artery. So hemiplegia and hemianesthesia of the face involving the face and arm region, then aphasia and also contralateral homonymous hemianopia. So you have to keep in mind aphasia mainly if the dominant hemisphere is involved, if the left dominant hemisphere is involved. So next we will see the posterior cerebral artery. So what will happen here? So posterior cerebral artery is mainly supplying these occipital pole as well as the lower part of the occipital temporal lobe, right, near the temporal pole. So here it will result in contralateral homonymous hemianopia. Okay, so this is mainly because of the involvement of the visual cortex, and there will be some degree of macular sparing. Okay, and why macular sparing happens? It is mainly because the macular vision is represented in the occipital pole, and this will receive a collateral supply from the middle cerebral artery. Okay, because the anastomosis exists between the middle cerebral and posterior cerebral artery in the region of the occipital pole. Okay, why macula is spared? Macular vision is spared because of the collateral arterial supply. There is a communication, okay, between the middle cerebral and posterior cerebral in that region. So it will be supplied through that. So next we move on to the arterial supply of medial surface. So the medial surface is mainly supplied, okay. So if you see the anterior 2/3, it's supplied by the anterior cerebral artery. Okay, so it includes mainly the paracentral lobule, which involves the perineum region, okay, the leg and foot region. Then we have the temporal here, so there the temporal pole, which is supplied by the middle cerebral. This is supplied by the middle cerebral artery. And then we have at the occipital, okay, occipital lobe, which is supplied by the posterior cerebral artery. Okay, so posterior cerebral mainly involving the visual cortex, that is the arterial supply of medial surface. Then coming to the arterial supply of inferior surface. Okay, so the arterial supply mainly here is by the posterior cerebral artery. So you can see majority of the area here is supplied by the posterior cerebral artery, and here a little bit it is supplied by the, okay, so middle cerebral. This is middle cerebral, so the lateral part of the orbital surface, here it is supplied by the middle cerebral, and here you can see the medial part of the orbital surface supplied by the anterior cerebral artery. So these are the main arteries which will be supplying the different surfaces of the cerebrum. Next, moving on to some of the clinical conditions which see in the region of Circle of Willis. One is the congenital cerebral aneurysms. Okay, so these occur, the congenital cerebral aneurysms, they occur more commonly at sites. So if you can see here where the Circle of Willis is formed, this is the Circle of Willis, and there we see. So here the basic abnormality is the congenital deficiency of tunica media, mainly the elastic fibers which is present in these arteries, okay, within the tunica media is deficient. So because of that, it results in aneurysms. So aneurysms are nothing but the abnormal dilation of the blood vessels. So these aneurysms, we call them as Berry aneurysms. Okay, so because of the shape, generally they are shaped like berries, so we call them as the berry aneurysms. So thus the berry aneurysms we see in the site where the two arteries join to form the Circle of Willis. Okay, so here we can see near the anterior communicating and the anterior cerebral artery. Here we are seeing near the posterior communicating artery here with the internal carotid, okay, and here between this posterior cerebral artery. So these are some of the common sites for the berry aneurysms. And berry aneurysms, as I said, it is because of the congenital deficiency of elastic tissue in the tunica media. So now the berry aneurysm sometimes can rupture, okay, so and that results in subarachnoid hemorrhage. So this is because of, here you can see this is a berry aneurysm and there is rupture and it results in subarachnoid hemorrhage. So commonly subarachnoid hemorrhage, not exclusively but commonly, it is because of the rupture of the berry aneurysms. And this produces, so in subarachnoid hemorrhage, the patient comes with sudden severe pain, okay, severe pain in the head, that is basically sudden and severe headache, followed by mental confusion, okay, so followed by mental confusion and headache, he comes to you, and usually the death is very soon, okay, and though sometimes the patient survives, it's only like survives the first bleeding, but only after a few days he may die, okay, so that is subarachnoid hemorrhage. So this is how we see, so this is the subarachnoid hemorrhage which we see in the CT. This is the subarachnoid hemorrhage. So next we just look at some of the vertebral system and the vertebral branches now. Okay. So I told you the blood supply of the brain is mainly by two systems. One is the vertebral system and other one is the carotid system. So the vertebral system, when we say, it is formed by the two vertebral arteries, okay, and the branches. So the vertebral arteries basically the branches of the subclavian artery. So it enters, okay, so we divide this vertebral artery into four parts, and the fourth part is when the vertebral artery, after passing through the foramen transverse areum, it pierces the posterior, that is the posterior atlanto-occipital membrane, okay. When it reaches the lateral mass of the atlas, it pierces that, enters the foramen magnum, okay, and there it will join, okay, where it will join and continues, okay, at the lower border of pons, where both the vertebral arteries will join and they continue as the basilar artery. So what are the branches of these vertebral arteries? So mainly we have the anterior spinal artery. So this is the anterior spinal artery. It gives anterior spinal artery. It also gives so posterior spinal artery. So posterior spinal artery may arise from the anterior spinal or sometimes from the posterior inferior cerebellar artery also. It also gives posterior inferior cerebellar artery, posterior inferior cerebellar artery. Then it gives meningeal branches as well as the medullary branches. So these are the branches of the vertebral artery, and where it joins near the lower border of the ventral surface of the lower border of pons, it joins to form the basilar artery. So those are some of the branches of the vertebral. Now let's see the branches of basilar. So the basilar artery, as we learnt now, so you can see here very nicely, this is the vertebral artery which is running on this along the medulla, anterior surface of the medulla or ventral surface of medulla, and at the lower border of pons. Okay, so it is joining to form, that is at the pontomedullary junction here, it is joining to form the, this is the basilar artery. So this basilar artery, it ascends in the basilar, this is the basilar sulcus which we see in the center here on the ventral aspect of the pons. Okay, and then at the upper border it will terminate. So this is the termination here, it terminates into two posterior cerebral arteries. So a pair of posterior cerebral arteries. So here this basilar, it will give the pontine branches. Okay, here you can see there are many pontine branches, and there is anterior inferior cerebellar artery, anterior inferior cerebellar artery. Okay, so this is, so posterior inferior was coming from the vertebral, anterior inferior cerebellar comes from the basilar. And then we have also the superior cerebral here. So this is the superior cerebellar. So basically all this supply the cerebrum, cerebellar artery. The pontine branches, they supply the pons. Okay. Then there is posterior cerebral artery. So posterior cerebral artery also we see, and the other branches other than posterior cerebral artery, we also see the calcarine branch, okay, which is also called as the calcarine artery and runs in the calcarine sulcus. So these are some of the branches of the basilar artery. So next is the internal carotid artery, which is one of the main arteries. So here I am just explaining as the brief things about very important to know about some of these arteries, not in detail, which is basically the high yielding concepts in the exams, that's it. Okay, so the internal carotid artery, it basically enters, okay, it enters the cranial cavity by passing through the carotid canal. So once it enters through the carotid canal near the apex of the, here you can see, near the apex of the petrous part of temporal bone, it will enter the cavernous sinus. So it traverses through the cavernous sinus, okay, near the floor and the medial wall, and then near the roof, okay, of the cavernous sinus, it pierces and it comes out here, you can see. So this is basically here, and once it reaches here in the subarachnoid space here, it will run backwards, okay, it run backwards and upwards, and then it will divide into its terminal branches. We have the larger middle cerebral and a smaller terminal, that is the anterior cerebral arteries. So this carotid artery, the course through the carotid canal, then through the cavernous sinus, and then again here, like this we call it as the carotid siphon. So basically it forms that intercavernous as well as the supracavernous course of this internal carotid artery. It produces this U-shaped bend, you can see here, and that is known as carotid siphon. So what is the importance of this carotid siphon? The carotid siphon, if you see, it dampens the arterial pulsations, okay, it dampens the arterial pulsations so as to provide a regular stream of blood flow to the brain. So the carotid siphon is important part of the cerebral angiograms. It is basically to inspect for masses of pituitary region which will open out, okay, or widen the curl. This curl, no, this U-shaped band will be widened in case of any pituitary tumors. Now we already saw the different arteries supplying the different surfaces of the cerebrum. Now these arteries which supply the cerebrum, okay, so we had the anterior, middle and posterior cerebral arteries. So these arteries will have a particular branching system. So mainly they divide into three groups of branches. One we call it as the cortical branches, then we have the central branches and then the choroidal branches. So the cortical branches, as the name says, they will supply the outer portion of the cerebrum, okay, the cortex, okay, the cortical part of the cerebrum. And the central branches, okay, central branches are, there are many central branches, they are very thin walled, okay, perforating branches, and they supply the centrally located parts of the cerebrum like the corpus striatum, the internal capsule, okay, all of that. And these central branches, you should remember, they are end arteries, they don't anastomose. Whereas the cortical arteries, they anastomose with each other. The central do not. They are end arteries. And these are arranged in four groups. So we have, like here, anteriorly, okay, so this is known as these arteries here. Okay, we have the anteromedial group, okay, so this is the anteromedial, this is the anterolateral, okay, these arteries will be the anterolateral, group, okay, so anterior medial, as you see, they arise from the anterior cerebral artery, so this is the anterior cerebral artery and they arise from that. Whereas the anterolateral group, they arise from the proximal part of the middle cerebral artery, anterolateral. And among this anterolateral, they are also called as the lateral striate arteries. And among these lateral striate arteries, one of the artery is larger and it is more susceptible for rupture, and that is known as the Charcot's artery, okay. So, Charcot's artery of cerebral hemorrhage. It is called the Charcot's artery of cerebral hemorrhage. Artery of cerebral hemorrhage or Charcot's artery. So, it's nothing but the largest striate branch, okay, striate artery, which is coming from the middle cerebral. Then we have the posteromedial group here. So, this is the posteromedial group, and they arise from the proximal part of the, here you can see, proximal part of the posterior cerebral artery, okay, posterior cerebral. So, proximal part of posterior cerebral as well as the posterior, here also you can see this is the posterior communicating. So, they arise from both of this, okay. And then we have the posterolateral group here. So, posteromedial, basically the thalamus, the subthalamus, hypothalamus part is supplied by these. And then we have the posterolateral, these arise from the posterior cerebral artery. So, this is the posterior. So, we have the posterolateral group, okay. So, this mainly supplies the thalamus and the geniculate bodies. Then the third group, okay, so we have the choroidal arteries. So, the choroidal arteries, they basically form a network of capillaries and they form the choroid plexus, which we see within the ventricles. So, we have the anterior choroidal and the posterior choroidal. So, the anterior choroidal, we see it forms the choroidal plexus in the inferior horn of the lateral ventricle, okay. So, the anterior choroidal and posterior choroidal, we have two. Posterior choroidal. So, posterior choroidal, anterior choroidal comes from the internal carotid artery, okay. It arises from the internal carotid artery, whereas the posterior choroidal arises from the posterior cerebral artery, and it encircles the midbrain around that region, and then we see it forms the choroidal plexus in the third and the lateral ventricles. So thus the arteries, okay, though we have the middle, anterior and posterior cerebral arteries, they form three groups of arteries. They give, okay, one is the cortical supplying the cortex, which anastomose. Then we have the central, which do not anastomose, and they are end arteries. Among them, they are divided into four groups: anteromedial, anterolateral, posteromedial and posterolateral. The anterolateral also called as the striate arteries, and among the lateral striate arteries, we have one artery which is larger, which is known as the Charcot's artery of cerebral hemorrhage, because it is more prone for rupture. And then the third group, we have the choroidal arteries, which form the choroidal plexus, and we have two: anterior choroidal and posterior choroidal. Anterior choroidal comes from the internal carotid, posterior choroidal comes from the posterior cerebral artery. Coming to the venous drainage of the brain, here the veins do not correspond to the arteries. Okay, so the arteries, we do not have their corresponding veins here, and all these veins, okay, draining the different parts of the brain, they finally drain into the dural venous sinuses, and from there the blood drains into the internal jugular vein, and from there it goes to the heart. So there are certain characteristic features which you should know about the venous drainage or the veins of the brain. Okay, characteristic features. So one is, as I said, the venous return does not follow the arterial pattern. Okay, they do not have the corresponding veins for the arteries. Okay, so they do not follow the arterial pattern, and they do not have valves. Okay, they do not have valves. Third thing is they are very thin walled, extremely thin walled in fact, okay, thin walled. And why they are thin walled? Because there is absence of muscular layer in their wall. Okay, absence of muscle in the wall, in the vessel wall. And these veins, they mainly run in the subarachnoid space. Subarachnoid space, okay. And the cerebral veins will open obliquely. Okay, so they open obliquely. And why do they open obliquely into the dural venous sinuses? So what happens is, following any increased intracranial pressure, to prevent the collapse, okay, so to prevent the collapse of the vessel, they run obliquely so as to regulate the blood flow. Okay, so that is the main features of these veins draining the brain. And these, we have the cerebral veins, the cerebellar veins and the veins of the brainstem. So you have to know that they ultimately, all of them, they drain into the dural venous sinuses, and dural venous sinuses, all of them finally drain into the internal jugular vein. A little note on the blood-brain barrier. So this blood-brain barrier, it is a semi-permeable membrane, okay, so as to prevent the toxins from reaching the brain, but allow the oxygen, okay, and the nutrients to reach the brain. So that is why we have this blood-brain barrier. So we have to know what are the structures formed by the blood-brain barrier. So what structures form the blood-brain barrier now? Okay, so the blood-brain barrier, we have the capillary. So first is the capillary endothelial cells. Okay, so these capillary endothelial cells and the tight junctions which hold them together. Okay, and then the basement membrane. The basement membrane on which these capillary, so where these capillary endothelial cells are arranged, or the basement membrane of these capillary endothelial cells, they form the second, and third will be the foot process of the astrocytes. Foot processes of astrocytes are nothing but the neuroglial cells which we see, type of neuroglial cells. So here you can see now, so the blood vessels, the basement membrane, and this is the foot process. Here you can see these are the foot process of the astrocytes. So these structures, they form the blood-brain barrier. So it will prevent any toxins, okay, toxic or any drugs from reaching, or exogenous materials from reaching the brain, but whereas they will allow the gases, that is oxygen and nutrients, to reach the brain. But there are certain areas in the brain which is devoid of blood-brain barrier. So this is a very important thing which you have to be aware of. Okay, so most of these structures, they start with P. So that is why you can, in that way you can remember it very easily. So let's see which are those P structures. One is the pineal gland. Okay, so pineal gland. So these areas are devoid of blood-brain barrier. Then we have the posterior lobe of pituitary gland. Okay, so you can see here. So the posterior lobe of pituitary gland, the tuber cinerum, then wall of the supraoptic creases of the third ventricle. Okay, here also you can see. So near the third ventricle, that is wall of the supraoptic recess. Okay, then other P here we can see, that is the area postrema. So this is basically at the lower end of the floor of the fourth. So this is the fourth ventricle here. So at the lower end of the floor of the fourth ventricle, we see this area postrema. So these are some of the areas where there is no blood-brain barrier. Now let's solve some of the image-based MCQs. So in the diagram here of the circle of Willis below, a berry aneurysm is most commonly found at the junction of the artery labeled X and the internal carotid artery. So identify X. Assume X points to the small bridge between two anterior cerebral arteries. So what is that small bridge here? So this will be the X point here. So this is the anterior communicating artery, right? So this is the anterior communicating artery. So let's see among the choices. Yes, we have the anterior communicating artery. So answer is B. The next question, image shows shaded lateral surface of cerebral, this is the superior lateral surface of cerebral hemisphere. Which artery is most likely occluded in the area shaded red? So which is this area supplied by? It is the middle cerebral. So this is middle cerebral, this is anterior cerebral, and this is the posterior cerebral artery. So it is middle cerebral artery. The next question. So the medial surface of cerebral hemisphere with the shading yellow. Okay, so here we can see near the paracentral. So where is the paracentral lobule? We have it over here. Which artery supplies this region? So which artery? Anterior cerebral artery. Okay, so here we have. So in this portion only a small part is middle cerebral. Okay, so here this is the posterior cerebral, this is the anterior cerebral artery. So diagram shows basilar artery giving off branches. A branch near pontomedullary junction is labeled X. Which artery is this? Okay, So here if you see X, so it is pointing to this, and this is mainly supplying the cerebellum. So it is more likely the anterior inferior cerebellar artery. Okay, so anterior inferior cerebellar artery is the right choice. Posterior inferior cerebellar comes from the vertebral. Okay, whereas anterior comes from the basilar. Superior we see in the upper part. So alright, that's blood circulation of brain made simple for you, and consistency as always, as I say, it's the key. So be consistent, key for success, and so be consistent with this series. I will see you in the next session.